As we approach fall, now is the time people typically start getting their new COVID vaccines. However, new guidelines could impact whether you need to take extra steps in order to do so. Inside Raleigh Pharmacy, manager Center Radhakrishnan has already heard from customers about the COVID-19 vaccine.
I have to ask them, what's your age? If they are below 65, then do they have any underlying diseases?
That's a result of action taken by the FDA this week, which approved updated usage for people 65 and older, though implemented a series of restrictions for those younger, most notably whether they have an underlying condition that would make them high risk.
They expect they can just walk in, anyone, and then get the vaccine like it used to be, but that's changed now.
According to the CDC, those conditions include asthma, cancer, chronic lung disease, diabetes, Down syndrome, heart conditions, and obesity, among others.
Most important thing for parents to do right now is to talk to a healthcare professional, talk to your pediatrician about whether or not your child is high risk, especially if you have a young child under the age of 2 months or if you're around anyone who is at high risk.
Health and Human Services Secretary Robert F. Kennedy Jr. applauding the move, writing in part, quote, "The American people demanded science, safety, and common sense. This framework delivers all three." The FDA plays just one role. Next month, the CDC's Advisory Committee on Immunization Practices is scheduled to review the approval, where they'd make their recommendations on its usage to the CDC. Ultimately, that could determine whether insurance will cover the cost or if patients may need to pay out of pocket. It's led CVS, the nation's largest pharmacy, to require patients in North Carolina to receive a prescription from a provider and meet the age requirement to receive a shot.
Since we don't have guidance for this season from the ACIP, that kind of creates confusion for the pharmacies in terms of what they can do. They can still administer COVID vaccines with a prescription. That remains the case.
CVS has implemented a similar policy in 12 other states, plus Washington, D.C. I'm Michael Perchik, ABC 11 Eyewitness News.